To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
Fighting on the front lines, United States President Donald Trump declares a national emergency as the nation continues to struggle against the coronavirus pandemic. Hello, I'm Anand Naidu, and this is The Heat. President Trump announcing a series of new measures to combat COVID-19, including freeing up some $50 billion to help fight the pandemic and ensure patients get the treatment they need. A move welcomed by health officials.
What you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that.
Just before that national emergency was declared, I spoke to Dr. Tom Frieden, former director of the Centers for Disease Control and Prevention, and asked him about his rather grim forecast that half the U.S. population could be infected and the death toll could be more than 1 million.
We did not make that as a prediction. We asked what might happen. It could be small, and tragically several hundred deaths. It could be very large. The key is that we work for the best and we plan for the worst. We wanted to emphasize to people that this could be very bad. We know in the US it will get much worse before it gets better. And each community, each healthcare facility, each individual needs to prepare so that we can learn the lessons from around the world and prevent as many infections and deaths and as much societal disruption as possible.
If the country is to prepare for what lies ahead, does it have the necessary healthcare infrastructure to cope with this, or is the infrastructure going to be overwhelmed?
I think, as we saw in both Wuhan and in Italy, a big outbreak will challenge any healthcare system in any city anywhere in the world. That's why the interventions like social distancing, teleworking, canceling mass gatherings, those are so important to reduce the peak of the epidemic, to reduce the likelihood that healthcare facilities will get overwhelmed and that there will be infections of healthcare workers.
What about test kits, Dr. Frieden? Why is the country having so much difficulty getting these test kits out to healthcare officials around the country, to healthcare workers? I mean, if you look at South Korea, they've been able to carry out up to 15,000 tests per day. They're even carrying out drive-by tests to make sure that the spread of the virus is confined to a single place. We also have China that's taken draconian measures to significantly reduce the spread of the virus. Why is this such a problem in the US?
Unusually, there was a problem getting test kits out from CDC. That's one of 3 ways that people can get tested. One is through public health labs that the CDC provides. The second is through hospitals developing their own tests. And the third is by commercial laboratories developing tests. And unfortunately, all 3 of those stumbled in this response. At some point in the future, we should evaluate what went wrong and reduce the chance that that will go wrong in the future. Right now, though, it's important to be clear about the role of testing. Where the disease is spreading widely in a society, testing people with mild or moderate illness may not make a lot of sense. And in fact, bringing those people into healthcare facilities to get tested may be a problem. That's why it's so important that we prepare healthcare facilities to surge safely, to reduce the risk of infection to healthcare workers, to plan for the possibility that large numbers of people with only mild illness may come in, and to prepare for the possibility that there may be a lot of people who need intensive care, including being put on breathing machines or ventilators, and get ready for that kind of surge so that we can prevent as many infections as possible and save as many lives as possible.
So what do we need to do now?
If we know already that coronavirus is in a community and it's spreading with chains of transmission that we haven't been able to track down, it's time to shift from contact tracing and testing every case to community mitigation, social distancing, exactly some of the things that China did, having people stay home, increase hand washing, ensuring that people cover their cough, making sure that if you are sick and you go out, you wear a mask so you reduce the risk of infecting others.
So what about people who do show these mild symptoms? If they don't go to the ER or to primary care, what's their alternative? And we've also heard cases where people first go to the health department, then they sent to the ER, then they sent to primary care. There doesn't seem to be any kind of streamlined, coordinated process here.
All over the world, primary healthcare systems are weak. There are only a few countries in the world that have strong primary healthcare systems. Frankly, neither the United States nor China are one of them. And that is a problem. What we'd like to see is a lot more telemedicine, and China's taken steps to do that, and that's being done in the US now as well. So you can call up or connect by email or online system with your provider, go through your symptoms, if need be, have a video call and see, do you need to come in? We wouldn't encourage people to go in for mild illness, but if someone is at risk of a severe complication, or if they're having trouble breathing, they should go to the emergency department. That's why emergency departments need to be ready to surge. That means ready to surge for people who don't only have mild illness and may need to be treated in tents outside, and surge in case there are a lot of people who are severely ill and may need intensive care. In that case, it's important to do things like canceling elective surgery, using operating suites as intensive care units, training more people to operate ventilators, calling down from the strategic national stockpile additional ventilators which can be used to protect and prolong life.
How important is it for there to be a consistent message to be coming out of the different branches of the government? You know, very often we hear one message coming from President Trump, then the healthcare professionals, people from the CDC, etc., are telling us something very different. And this is causing a lot of confusion among people.
I would like to hear the U.S. Centers for Disease Control and Prevention briefing the public every single day and outlining what we know, what we don't know, what we're learning, how we're learning it. That's important because even though this has been around now for a few months, there are an enormous number of really important questions that we don't have the answers to. We don't know, for example, whether children spread this virus. We don't know whether it commonly spreads from contaminated surfaces. We don't know how it is spreading in hospitals and therefore how best to protect healthcare workers. And we don't know who is most at risk of dying by detail. We know it increases with age, but what conditions? Diabetes, in control, out of control, emphysema, asthma, heart disease, which heart disease? There are lots of questions that we don't know the answers to, and the more we know, the better we can protect people.
What do you make of the travel ban that was announced by President Trump just a couple of days ago? Most flights from Europe will be affected. Not all countries, but most countries in Europe will be affected. Do you think that will have a significant impact on bringing down the spread of the virus?
Reducing travel can delay the spread of disease, and that's useful if we make good use of that time to better prepare every individual, our healthcare facilities, and our society for an all-of-society response.
You oversaw the U.S. response to the 2009 H1N1 influenza outbreak. Then in 2014, of course, we had the Ebola epidemic. And in 2016, the Zika epidemic. How different is this coronavirus outbreak from those outbreaks in the past?
Each outbreak is different. Each has its own challenges. But this is enormous. If you look back at infectious disease outbreaks and you ask how much community, economic, societal disruption has there been, this is the most disruptive infectious disease event in more than 100 years, since the 1918-1919 influenza pandemic. That's why every country, every individual needs to be ready to respond and prevent.
In the case of Ebola, how were the healthcare officials and workers in sub-Saharan Africa able to contain the outbreak just to a region of Africa?
Each virus or pathogen is different. Ebola can be contained. It could be stopped, just as SARS, another coronavirus, was stopped. Right now, it does not look possible that we will stop novel coronavirus, COVID-19, from spreading and continuing to spread around the world. Only time will tell for how long it spreads, where it spreads. China's heroic efforts have stopped spread in nearly all of China now, but what will happen in the coming weeks and months and years, only time will tell.
What about funding? Looking at some figures here, according to the current budget proposals, the Trump administration is calling for a $1.2 billion cut to CDC funding. That's for 2021, and a $35 million cut or decrease to the Infectious Diseases Rapid Response Reserve Fund. However, we should mention that the president has signed into law an emergency package worth $8.3 billion, which is going to be spread over several years. But on funding, does that have to change right now?
Each year, the Trump administration has proposed cuts to the U.S. Centers for Disease Control and Prevention, and each year Congress has known better and has defended against those cuts. There is one area that really does have a financial gap, and that is support to countries around the world so they can find faster, stop sooner, and prevent wherever possible health threats when they first emerge, something called the Global Health Security Project. That program was funded under the Ebola supplemental funding, and that funding has dwindled and really is needed. And we need that not just from the United States, but from China, from Europe, from the Nordic countries, from all countries in the world, because events like this can often be prevented. And all of us need to work together so that early warning and rapid response systems in Africa and Asia and all around the world are much stronger so we aren't caught off guard again. It's inevitable that there will be more outbreaks of infectious diseases. What's not inevitable is that we will continue to be underprepared as a world.
Dr. Frieden, thanks so much for joining us, and thanks for your time.
Thank you.
Well, let's continue our discussion now with our panel. James Chow joins us from Hong Kong. He's a WHO Goodwill Ambassador for Sustainable Development Goals and Health. Joseph Williams is Senior Editor at U.S. News & World Report. He joins us right here in Washington. And from New York, Anthony Chan was a former chief economist with J.P. Morgan Chase. Welcome to all of you to the show. Joseph Williams, let me start with you. I was looking at some figures just a moment ago on the current situation in the United States. The number of cases here has now passed 2,000 and the death toll stands at 45. Of course, just a few hours ago, President Trump addressed the nation from the Rose Garden at the White House. He declared a national emergency, as we've been reporting, and also announced that $50 billion package that will be made available to state and local municipalities to fight this outbreak. So, Joseph, what did you make of today's developments?
It was a good step. We've come a long way from when this was a political hoax, and I thought it was really significant that President Trump managed to get in front of the cameras and talk about this in a semi-serious way. He'd had an address to the nation last night that didn't go quite so well. This one did. He relied on a lot of his experts. And even the announcement of a state of emergency was a huge development in this story because it put people on notice that yes, the White House is engaged, that yes, they're going to signal some funding and try to get ahead of this disease. And yes, they are taking this seriously and the president is in front of that. That being said, it is a little, I mean, we're going to, only time will tell whether or not this was too late to prevent more deaths. I mean, certainly it's in time to prevent future deaths, but the ones that have already happened and the fact that the government got caught flat-footed, this helped make up for that, but you still have that lingering over the whole emergency.
Right, and Joseph, and I mean, we're looking at pictures right now from that Rose Garden news conference. The president was also surrounded by healthcare professionals, people like Dr. Anthony Fauci from the CDC, as well as a host of business people, captains of industry, especially the healthcare industry here in the United States. What kind of message was that sending, if you look at the optics of that?
The message was clearly to the stock market. And as far as the stock market is concerned, message received. The gyrations that we saw over the last couple of days, the really wild swings and the twice in a week triggering of the circuit breaker, that sent a very strong message to the White House, I believe, that in order to stabilize the markets, you have to let people know that you're serious. And that message was delivered by the Dr. Fauci's of the press conference and the other captains of industry, as you say, because it's them who pretty much are going to signal whether or not this is something that needs to be addressed more firmly. So I think that that was what the president was trying to convey, and I think it was to a degree successful.
Yeah, Anthony, let me get your view on that. The White House has enlisted the help of the private sector in this fight against the coronavirus. And looking at the numbers today, Wall Street seemed to have liked what they heard from the White House. The Dow closed almost 2,000 points up. What did you make of the president's address? What exactly is Wall Street looking for here?
I think Wall Street is looking for a multi-faceted approach to handling this virus. They want, of course, the central bank to do its part. They want us to really prepare to mitigate the spread of this virus. And then when they also want economic stimulus to make sure that somehow the parts of the economy that are negatively impacted will be buffeted from this. And I think that today we're starting to see and hear more and more of the components that Wall Street has been looking for quite some time. As you heard before, the impression on Wall Street was that it was not being taken seriously enough. Now I think that, I don't want to say this is the big bazooka, but it certainly is starting to look like a bazooka. And at some point, Wall Street may demand even more, but for now, Wall Street was very satisfied with what they heard today, and I hope that that will continue to resonate in the White House, so that if the situation were to get worse, the numbers have to get bigger. And in fact, we heard from Steve Mnuchin, the Treasury Secretary, indicating that no matter what they do today or this week, that they still are in the early innings in terms of the reaction of the White House. And so when you take into account what the President said, what the Treasury Secretary said, the voice was certainly encouraging to Wall Street.
All right, let me bring in James Cha from Hong Kong. James, great to see you. The chief of the World Health Organization says Europe is now the epicenter of the outbreak. Let's listen to what he had to say.
Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China. More cases are now being reported every day than were reported in China at the highest of its epidemic, at the height of its epidemic.
So, James, if we look at the information coming out of China, the message from China right now is that the number of infections, new infections, has decreased significantly. What does that tell us? And is it time for Europe to implement some of the very draconian measures that China took when this outbreak started?
Anand, I think that that time has passed a little bit for a lot of countries and governments. There have been 2 months when they could have done this. Tedros talked about the alarming inaction on the part of countries a couple of days ago when he called and characterized this outbreak as a pandemic. One wonders what have they been doing all of this time. And I want to add one thing, in just, this is in purely personal capacity that I say this now, and it's not in reference to any one particular country over here. But who cares what the financial markets think? You're in a national emergency, you're in a global emergency. You shouldn't be worrying about how the markets are performing or what traders you're appeasing over here. You should be completely zeroed in on the discipline on tackling this health crisis over here. This health crisis, if you don't handle it, is going to get even larger and even deeper. And to be quite frank, in all of these countries, we don't really know how many infections there are. This was one of the criticisms made of China in the early weeks, that perhaps the numbers weren't perhaps so accurate. How were they counting? Why were they changing their methodology? But in this case, if you take that, this isn't an improvement on that at all. We don't really know how many people are confirmed cases or numbers of people dying from COVID-19 beyond what you get in the situation reports by WHO, which are reported by its member states. We need to know in this endemic flu season who's actually infected with COVID-19, who's actually infected with the flu. As Dr. Frieden said over there, are these children that we have labeled lower risk groups, and we've been looking and concentrating very much on the aging populations, are they super spreaders? We know that when our children go to schools, they all get sick because they're excellent at transmitting viruses, especially the flu. This is not a flu, but it displays flu-like symptoms. So I don't think we still see the seriousness from countries around the world.
Anthony, James raises a good point there. I mean, should we really be concerned about what the market thinks?
Well, I never said we should be concerned. You asked me the question about why the financial markets reacted the way they did. I think all along this has been a healthcare crisis, and we have to treat it as such. We do know that there are some people out there that think that the market is important because it has economic implications, but life and death and people's lives are certainly more important. But we know that this virus will have economic implications. I think that it's pretty clear that in the United States we're going to have negative economic growth in the second calendar quarter. The possibility that unless we really spend a lot on fiscal stimulus and monetary policy, that in the third quarter you'll have negative economic growth. Having said all that, that still doesn't take away from the fact that human lives are at stake, and perhaps we can easily make the strong argument that human lives are more important than whether you get 1 or 2 calendar quarters of negative economic growth. But when you ask the question, why are the markets reacting positively, I certainly had to give you the answer that they were encouraged by what they heard.
Well, see, and if I may jump in here for a minute.
Go ahead.
One of the reasons why this matters, or why the market mattered here, is you're absolutely correct. There are lives that have been lost. Many lives have been lost, more that probably would have been lost had this president acted, and this was the one thing that got his attention. We'd been, there have been health experts yelling about this. The alarms had been raised all over the place. In China, there had been some conflicting figures. That's irrelevant. If the experts say that it is on its way en route to the United States, you have to take it seriously. And this administration clearly did not until the stock market, which is something that this president is very much attuned to and very much uses it as an identifier of his success. When it started speaking to him loudly and clearly, you are not taking this seriously enough. That's the message that finally broke through and finally convinced him to do something rather than just kind of play it off as another political hoax or downplay it as something that he didn't need to be bothered with at all.
Anthony, one other thing, and that is the $50 billion that the president announced will be made available to states, local municipalities around the country. How will that money be used?
Well, we're going to see that a lot of that will be used to offset the negative impacts on unemployment insurance, for example. It is no secret that in the United States, a big percentage of the population doesn't have money if they all of a sudden have an emergency expenditure of $400 or more. So even though the lives are important, if all of a sudden now people are losing their jobs and the federal government is not backstopping and either increasing the size of unemployment insurance or giving them money for testing and making those tests cheaper, we can spend all day talking about how many lives are going to be lost. But you got to also remember that the people that are losing their jobs and maybe not being able to pay their mortgages, we know that those things have health considerations. People get depressed, suicide rates go up. So we do have to not necessarily be focused so much on the stock market, but we do have to be focused on the economic implications of this virus. And that's what the $50 billion is going to go towards, mitigating some of that negative economic impact. And we have to really address this on all facets of life, the healthcare, the economic aspect, and making sure that we spend as much money as we can to find a way to mitigate this terrible health situation.
James, there have been some very positive reports about the efforts that have been made in places like Singapore and in Hong Kong, where you are right now, to combat the spread of this virus. They seem to be prepared for it, according to some of the reports. What are the measures that they took?
Oh, can I just first of all say that no one has been fully prepared, but certainly, as you said, Anand, we've seen some positive cases, and I didn't mean to be disrespectful to our fellow guests in this program. It's just 7-something in the morning in Hong Kong, and I had excellent sleep. So let's look at some of the issues over here. I think what they did well was that they were very, very good at testing. You look at South Korea, they're on it. I mean, they're doing about 10,000 tests a day, whereas in the United States, we're looking at maybe New York getting 6,000 tests next week. I think also what they've been very good is at mobilizing community leaders, although we can do a lot more of that. And I think in China, I mean, some people call it draconian, and I can certainly understand why they would say that, meaning severe and excessively harsh. But we live in these very excessively harsh circumstances over here in locking down cities, which we've now seen copied in Norway, in Italy. I wonder whether that's going to become a template for future outbreaks in responding to over there. But can I just add over here that apart from the excellent measures that we've seen in some parts of the world, the president calling this $50 billion fund is significant, as we've heard from the other guests. And he has surrounded himself with very, very good people. People like Tony Fauci and Debbie Birx, who I both know on a professional basis through our work in HIV and AIDS. Debbie Birx said today, and she made that very strong link between the early years of the HIV/AIDS crisis, which the United States, of course, to this day has helped turn around on a global scale, talking about testing and treating. And that's exactly what Tedros has been saying as well, pointing to the 6 elements of detect, test, and trace, and then going to isolate and to mobilizing your community. And also Winnie Byanyama of UNAIDS saying that people living with HIV must continue to have access. So I think what's really important, and where we can go even better than what we've seen in Asia, is ensuring that there's a people-centered approach and that there's a human rights approach to all of this. But I think what Asia did very well is that they were very, very strict and very tough, and that they encouraged social discipline amongst their own people, and they were very, very unbending on that. Not all cultures will be open to doing this, but let's see if they can, because as I said, these are very, very tough times. And economically as well, paid sick leaves. I was talking to a friend in the UK yesterday who works as an electrician. He says that he's taking time off now because his young son is displaying flu-like symptoms. There isn't any suggestion that he has COVID. But if he doesn't work, he doesn't get paid because he's not on a salary, he's on a wage. So where are we going to see? We saw the US Congress move very strongly on ensuring that there's more affordable access to these tests going forward as well.
Okay, thanks, James, and thanks to everyone else on the panel. Thanks for being with us. That's it for this edition of The Heat. I'm Anand Naidoo in Washington, D.C. Thanks for watching.